My name is Dr. Andrew Koivuniemi. I'm a neurosurgeon with Franciscan Physician Network. ACDFs, or anterior cervical discectomy and fusion, is one of the most common surgeries we as neurosurgeons do. It's very usual to have changes in your neck that eventually start pinching the nerves that go from your neck into your arms or the spinal cord in the middle of the neck. When it pinches your spinal cord, that causes something called myelopathy. Myelopathy usually affects people's coordination with their hands and their balance, and it's a very serious problem. When we find someone who has myelopathy, we almost always recommend surgery because what we're trying to do is prevent you from getting worse, and we hope that with time and with therapy, you're going to get a lot of that coordination back. Patients who have pinched nerves as opposed to a pinched spinal cord, that's not as big of an emergency, but it's a very satisfying surgery for both me and for the patient. It's typically an outpatient procedure. Typically patients take just an hour or two to get the procedure done, and they often notice significant improvement in the pain that shoots from their neck into their arms within a couple of weeks of surgery. I would say good candidates for these types of procedures are patients who have failed other measures, so you have tried to work with physical therapy, you've tried other medicines, or you've tried some of the other pain techniques, such as injections, and you're not getting any better. If that's the case, then you should very much be seen by a spine surgeon so that they can talk with you about what your particular options are. If you continue to have pain and we can find a pinched nerve in the neck that's a cause of it, the good news is this surgery offers a 90 to 95% satisfaction rating. In other words, the vast majority of patients who undergo this surgery, who are well worked up and taken care of by experienced hands, do extremely well and are grateful that they had it done. So what type of recovery can you expect from this procedure? Well, most of these surgeries are just 1 or 2 levels of your spine. And in those cases, the vast majority of the time, we're able to get you out of the hospital within 24 hours. Your pain is usually moderate to minimal, and most patients notice that their pain that they experienced prior to the surgery is improving. You can expect to get back to work typically within 6 weeks of this surgery. Sometimes some patients take a little bit longer to improve, and sometimes, especially if you have myelopathy, it can take up to 1.5 years to see full benefits from this surgery. If you're experiencing these symptoms like difficulty using your hands, difficulty walking, pain that shoots from your neck and into your arms, please let your primary care doctor know about it. Sometimes these things are not caused by issues with your spine, but if they are caused by something in your spine, it's a great idea for you to be seen by a spine specialist so that they can come up with a tailored approach to help you solve these problems. If you have any more questions, please visit us at franciscanhealth.org.